Hello, I'm Bob Ghelfi. I'm the medical director at the Body Logic MD of Sacramento office, and we practice anti-aging medicine. We help people with hormone balance, with nutrition, with fitness, with weight loss, and we have a very rewarding practice there. Everybody who comes there is anxious to learn how to take care of themselves better and to really participate in their health. Most of the people that we see have some hormonal imbalances, and getting them to feel good and getting their hormones balanced so that they can actually have some motivation to tackle those other two problems, which are fitness and nutrition, which are really key. And I actually tell them, we can balance your hormones, we can get you in better shape from a medical perspective, but if you don't motivate yourself and if you aren't equally motivated to take care of your nutrition and your fitness, it won't matter. You're just wasting your money. Nutrition probably plays as big a role as anything in our practice, and yet it's the hardest thing to actually communicate to. It requires discipline. It requires a tremendous change on people's part, and it's not like we follow them home. They can leave our office and go right to McDonald's if they want to. So a lot of it is their desire to actually act on the information that we give them. The other thing that's true is that adults my age, adults, middle-aged adults, there's almost no way for them to actually be their appropriate weight and healthy weight without exercise. We try to emphasize to our patients that really they need to be able to work themselves into exercising an hour every day. And a lot of them think, well, you know, I really can't do that. I just don't have time. But they all have time. And so we have to actually help them reprioritize how important it is for them to exercise. Because if they don't exercise, no matter how good their hormone balance is and how good they're eating, they're not going to be at their optimal health, and probably not even close. The predominant number of patients are people with hormonal symptoms. That's really the draw to our practice, I think. And I would say the predominant number of them are in their 40s to early 50s, and really predominantly women, although we see a number of men too. The issues that they come with, like sleeplessness, one of the top issues that we see people for, like weight gain, probably in the top 2 or 3 of issues that we see people from. Hot flashes, moodiness, irritability, those are symptoms that are really dragging them down to that point. And a lot of times they've been to their regular physician who's put them on an antidepressant of some sort, and really just they've given them the 10 minutes that they got coming for their evaluation, written a fairly quick prescription, sent them on their way, and it doesn't help them. And not only does it not help them, but the patient knows it's not going to help them going in because they know they're not depressed, and they just know something isn't right. So it's always fun to see those patients because we know we're going to get them better, and that kind of helps us say, listen, we'll take care of this part. Over the next few months, we're going to dial you in and get you feeling better, but you're going to need to use that as a springboard for the rest of your life.
I was having really bad periods, worse than I think I've ever had, lots of cramping, and I was just really, really bad cycles. So I went to my OBGYN first, and she said, I'm going to give you a dose of Seraphin. It's a very mild dose, and I'm like, that's not like an antidepressant, isn't it? She goes, no, not really, it's Seraphin. And I said, okay. So I started taking it, and I felt a little better, and my cycles got a little better, but I was still feeling tired and kind of moody and what have you. So I was doing some research on hormones, and I figured something has to be going on as you get older. So I found Body Logic. So I went and I started to explain to them kind of, I work out a lot, I eat pretty healthy, I'm on the go all the time, but these were some of my symptoms. And then I also told him about what my gynecologist recommended, and I said, and she said it's not like an antidepressant or anything, and he looked at it and he goes, oh no, it's Prozac. So it was a real kind of a shocker. I was like, oh, and he goes, and you probably don't need it. You're probably not depressed in that type of way. So I got my hormones checked, and they were a little out of balance, and so we worked on a plan. But it was just enough to really optimize and kind of get me over that hump to sleep better and to feel better and to not feel as moody, feel more myself again.
If you'd like to learn more about me and my practice, you can go to bodylogicmd.com, and all the information about my practice and the things that we'd like to do for you are online and available.